Welcome friends to the 8th World Om Day, and today's seminar is on Vedic medical astrology, an overview of Vedic medical astrology by none other than the master of Vedic astrology, Dr. KRRISSH Charak. So the World Om Day is an initiative of NGO which I am one of the co-founders, called KRRRISSH, which stands for Karmic Restoration and Revival of Indo-Vedic Scientific and Socio-Cultural Heritage. And it was an idea which was in my mind since 1990 for creating the awareness, for increasing the applications and evidence-based research on Vedic concepts and Vedic science. But ultimately it materialized in 2018 when one of my friends, who is a well-known astrologer, Pandit Dev Vasisht, we came together as co-founders to start KRRRISSH. And today we are, on the Vikram Samvat, the first day, we celebrate as the World Om Day, and we keep a seminar on one of the scientific aspects of Vedas. So this year it is on Vedic medical astrology, and the speaker is none other than Dr. KRRISSH Charak. So Vedic medical astrology is not a alternative system of medicine. It's actually a complementary system of medicine, and it used to prevail in the Vedic times. And with 30 years of experience, and Dr. Charak has more than 50 years of experience, we can 100% say that this should be put into practice by all practitioners of medicine, maybe allopathy, Ayurveda, Unani, any system. Anybody who's practicing medicine, it will not only help like any other field for diagnosis, like we are using the radiology techniques, we are using the pathology, we are using genetics. You can use the horoscope, the charts of your patient to help in diagnosing the disease, in managing the disease, in predicting probably the outcome, and even in preventing the disease. A lot of aspects of Vedic medical astrology. We need to have the skilled manpower, doctors, modern doctors who are trained in Vedic medical astrology, and the funds to do research, and it will be wonders for the health of the world. So why did we keep this particular topic in our mind as one of the things we want to promote under KRRRISSH? There are certain objectives. So, so this is the topics which Dr. Charak will be talking on today: the relevance and scope of medical astrology, natural and functional benefits, horoscope, body parts, physiological functions, then Balarishta Yoga, congenital illnesses, sound and unsound health, onset and outcome of disease, indications for heart disease, indications of mental health, and about the genetic link, which today we are thinking that we'll be able, with the help of genetics, we'll be able to prove the truth about the Vedic medical astrology. And the objectives of the day today, which we have kept this World Day as Vedic medical astrology, promoting evidence-based Vedic medical astrology, training doctors in Vedic medical astrology, laying down simplified guidelines for medical diagnosis in astrology, then including Vedic astrology in the traditional complementary alternative system of medicine in Ayush, promoting research projects in Vedic medical astrology, and regular conferences on Vedic medical astrology, and setting Vedic medical astrology research centers in hospitals across India. So this is what Hippocrates, we as doctors take a Hippocratic oath after doing our MBBS, and this is what he has to say: a physician without the knowledge of astrology has no right to call himself a physician. So that is the way we have to move forward. Every physician should know Vedic medical astrology and apply in his practice. Health and medical genomics and epigenetics is a complementary science of Vedic medical astrology. So I was talking to Dr. Viveka Kumar, who is the head of cardiology of Max Hospital. They are setting up a genetic research center in Max. And I was discussing with him that Genetics will be able to give you some idea just by looking at the genes, the chromosomes, taking the blood sample, that what are the possible diseases one can have in life in future, and maybe in diabetes, hypertension, malignancy, whatever, and predict and what precautions you can take. Similarly, we can use the horoscope of the patient to predict that when and what kind of disease a person can have and what preventive measures one can take in his future life. So I think somewhere this convergence of genetics and Vedic medical astrology is coming up. As I said, our genes contain all information about our prarabdha karmas. So one thing which I feel the modern astrologers fail to take into account is the life we have lived till we are in this world. So what do we do is, normally when we erect a horoscope, it is a horoscope at the time of birth. It gives you the information that what the planetary position at the time of birth. Plus we use the dasha and the transit, that is what is the position of planets today. But we do not take into consideration that if a person is 50-year-old, then what karmas he has done in these 50 years. Because this karmas in 50 years also adds to his prarabdha. We know that the karmas, one of the definition is the sanchit karma, then the prarabdha, then kriyaman and agami. So sanchit is the entire karmas in a person has done, and in this birth whatever his karmas he is doing is the we is born with the prarabdha is the one he has to experience his birth, and then what he is doing on day-to-day life is the kriyaman, and what he will be doing in the future is the agami karma. So with time, whatever are the kriyaman karmas, they become prarabdha, and whatever the agami karmas, they become the kriyaman and they become the prarabdha, and ultimately add to the sanchit karmas. So we have to really, as an astrologer, take a history. Like as a doctor we take a history, as an astrologer we have to take the history, that in the last, since you are 50, because we have seen a lot of horoscopes where it shows that a person is could have a major heart attack, but actually when the time comes he does not have. And when we ask him the history, he has taken full control of his weight, he's kept his LDL in control, he's a non-smoker, he's a non-drinker. So he has taken preventive measures, which is definitely affecting, because ultimately it's all about the karmas, about the actions we do in life. Some people also call Vedic astrology as the Ayurvedic astrology, but Ayurveda is one part which deals with the Aushadhi part, the herbal and the plants which we use in treating after we diagnose whatever a person has a disease. So as I said, Vedic astrology is not an alternative system, it's a complementary system to help physician in prevention, diagnosis and management of disease. And things are changing, people are looking towards this thing. The Rajasthan government has come out with a proposal of free horoscopes to all the children born in all hospitals, departments of Vedic medical astrology research in hospitals, and free consultation for astrology if somebody borns in the hospitals. So this is coming up. Governments are taking this issue seriously, that Vedic medical astrology has to be promoted. And even Madhya Pradesh government has come out with the proposal of Astro OPDs, and it has at present started probably in the yoga centers, and this is the thing. And this was an article which was about the NHS doctor, a member of parliament of UK, who said that astrology could help take pressure off the NHS doctors, claims conservative member of parliament. He said, I have been using medical astrology for the last 40 years and I have seen its benefits. And if it is added in the healthcare system, it will reduce the cost and it will prevent a lot of diseases. David Trendick. You can see it on the Google, just put in the Google, UK lawmaker promotes medical astrology, and everything all articles you can see. And so this was a news. Soon newborns in the Rajasthan hospital to get free horoscope, and newborns to get horoscope in Rajasthan hospitals. Then this is some of the people promoting, some astrologers are promoting astrology. And this is just a slide I am sharing because Dr. Charak will maybe able to shed more light. So when we divide the body parts, there are a lot of ways we can divide on the basis of the houses, on the basis of the planets, which planet rules which body part, or which nakshatra which rules which body part, or which zodiac sign. So as a radiologist, when I used to see the fetus in the babies in the mother's womb, and I used to see the position. So the way the position of the fetus and the distribution of the body parts, it appears that the Vedic rishis knew about the fetal position and how during the 9 months of growth, the fetus is being affected by the various planets and the nakshatras. The only thing I find here is that this baby has a flexed leg. But when we go to the astrological the feet somewhere in the house number 12. So maybe it's a baby with the extended leg. So I think a lot of research need to be done to look into these things deeply. And this is something about remedial astrology. Does astrology can do something about preventing disease or treating disease or reducing the severity or curing disease? Yes, there have been scripts which showing about this, but we need to do a lot of research. We need funds, as I said, and we need doctors who are trained in Vedic knowledge so that they can promote this thing. And so the mantras can be used, gemstones are used, plants and herbs, and then you donate something, then services, and then bathing with certain constituents. As far as mantras are concerned, we know that there was a research on the Gayatri mantra in AIMS. MRI, functional MRI of the brain was done, and a lot of things came out that while doing the Gayatri mantra, the certain areas of the brain, like memory, got increased blood supply. Similarly, there was Mahamrityunjay mantra. There was in the coma patients. There was a research conducted in the RML hospital by the neurology department by Dr. Chaudhary, and they came to the conclusion that they had 25 patients who were not put on mantras, and 25 were made to listen, coma patients, to the Gayatri, to the Mahamrityunjay mantra, and after 1 year certain biological changes were different in both them. I don't know the detail, but I definitely know that in the group where did not listen to the Gayatri mantra, that there was 1 death, and there were 5 deaths, and the one which listened to the Gayatri mantra, after 1 year only 1 person died. So I think a lot of research is, but the things are moving in the right direction. We are moving towards research on the Vedic medical astrology. And then there was another research which was done by UNESCO on dyslexic children. So the MRI was done, brain MRI, and they were made to listen to 3 kinds of sounds. One was the alphabets, A, B, C, D. Other was to listen to the horn and the whistle and the siren sounds. And the third was Om. And they saw that in the first 2 kinds of sounds, there was no change in the blood supply of the brain, but when the children were exposed to the sound of Om, there was increase in certain blood supply in certain parts of the brain, and this is something which is very, very important observation. And gemstones, I do not know how much research, but I can tell you about my personal thing, that as a radiologist, I had to see a lot of infertility cases, and I remember prescribing the Pukhraj and the yellow sapphire to more than 50 of them, and when we got their semen analysis done, the sperm count increased, the motility and other morphology, there were changes for the betterment. And even when I did the ultrasound, the ovarian follicle which were not maturing, in some cases the maturation levels were better. So that was, and a lot of cases where wearing the yellow sapphire, which is a sign of, which is for the Jupiter planet, we could see conceiving the baby. So, but these are very initial findings, and we need to do a lot of research. These are just indicating on the effects. And then of course, we know that when we do prayers, they say that After the prayer, we put some part for the ants, for the dog, and for the cow and different animals. And the theory is that it represents certain planets which help us for a better life and everything. And we also, some people, you know that it is internationally, even USA, they are saying that if you have depression, you go to a cow. You feed a cow, you touch a cow, you call a cow for half an hour, and it will help you in depression. Because even as per Vedic astrology, moon is the karak for depression, for mental health, and of course cow represents moon, mother represents moon, and definitely it could be a correlation. So we need to do research, and it's a good thing that things are moving over that side. So as I said, these are some of the horoscopes I am just sharing. Infertility, I see that in the horoscopes when the Jupiter is somehow affected, maybe in weak position. Dr. Charak will be detailing on the role of Jupiter, but it is weak in some kind, infertility is affected. In almost every horoscope I've seen, when there is infertility, Jupiter is a very major planet which is very weak. And so if we strengthen Jupiter, this is one of the points, there are other reasons also, but infertility I found that. Then heart, of course, if you see this particular horoscope, so Sun is the karak for heart, and anything which happens in the Rahu-Ketu axis, any planet, and this is the house for the heart. Dr. Charak will be talking much about the heart and the conditions, but fifth house Lord, Sun, whenever they are afflicted, they are weak, or they are affected by malefic planets, Rahu-Ketu, the possibility of heart attack, and when the dasha comes, it happens. And this is one of the horoscope which was my personal experience. I was in a hospital, my close relative was admitted, very serious in the ICU, and by chance I had my laptop there, and I had this horoscope in which I could follow the transit of the planet with every minute and every second. So I was just observing what was happening. So if you see, then in the sixth house, there was this combination of Venus and Ketu in the transit. And we know that Ketu moves in one direction, Ketu and Rahu means in the opposite direction, rest planet moves in one direction. So what was happening, I was just observing what was happening. People were there, I was sitting in the car and looking at the horoscope and seeing what's happening. So when the Ketu was moving, so Ketu and Venus were moving towards each other. So when and Venus was life and Ketu was death for her. So as they were approaching, almost when they were very close to each other, the doctor from the ICU said that she is dead, call the relatives. All the relatives that she's no more, and all. So they started calling, and the person very close to me, and everybody started crying. And it was Saturday, and I said, let me do something if we can do. So I called all relatives, start Mahamrityunjay mantra on behalf of that person. And somehow my Dev is not a friend. He was in Kedarnath. By chance, I called him up. Where are you in Kedarnath? I said, start Mahamrityunjay mantra there immediately, and you will not to stop it, tell the Pandit till I stay. And you know, I was observing this position. So the moment they crossed the roads, Venus started coming this side and Ketu started doing that side. And all relatives gathered. And the doctor comes out from the ICU, wait. She's responding. And then I said, no, I was looking at the movement of the planets, and my confidence grew. I said, continue. You chant the Mahamrityunjay mantra. It was Saturday, and whosoever has a nearby Shani mantra, just do whatever is advised of Sarso ka tel and til and whatever it is. Don't stop till I tell. So after 2 hours, as I was a doctor and close relative, they called me in, and they showed me the X-ray. So the pre-X-ray was totally white. Lungs were totally fluid filled. And 2 hours after this thing was happened, I could see the lungs coming back and the water going out. And by 24 hours, and she's alive even today. So, close monitoring we do. And it was just a chance that I was there. I was in the car at the horoscope, and I had the software which could tell me every moment what is happening. So to follow every moment, you will just enjoy. If you see, or even your patients, if you see, you will enjoy this thing. And you will see how the power of planets and everything. And now Dr. Charak, he's my guru, he's my inspiration for medical astrology. He's doing medical astrology teaching medical astrology for the last 35 years. And I've learned a lot from his books. Whenever I'm in trouble, I seek his help, I seek his guidance. He's helped me, a lot of patients when they come to me. And they say, so I asked Dr. Charak and he's guided me, and it's a beautiful experience of how Vedic medical astrology can help in managing the patients. And these are two of his books, which it's so simple. He has made medical astrology so simple. You just read the books and you will just start practicing and have his guidance. And this is of course about him. He's a surgeon. Of course, we have shared the same alma mater. We are both from Al-Azhar Medical College, and then he's done. I did my radiology. He did his surgery, and then his same institution, Bharati Vidya Bhavan, he did almost a post-graduation kind of a Jyotish Visharad. I did a MBBS course, Joshit Alankar, but then somehow God made us meet together. And this is the Panchang. You see, Panchang is the Vedic or Hindu calendar, annual calendar, which you will, as a medical astrologer, need to know the basics of Panchang. Panchang means there are 5 angas, 5 parts of sound of time. Var, Tithi, Yog, Nakshatra and Karna. And everything has a role, because life is all about timing, being at the right place, the right moment, the right time. And timing is the main thing, everything. That is what is all about Vedic astrology and everything. So you need to know the Panchang. It's very simple, very easy to understand. And so Panchang has 2 kinds of ways of explaining things. One is the using the mathematics of the Sanskrit style, where they have the timing according to that, and they have this showing the planetary positions. And the other is the one which I use, is the system which uses the time in terms of hours and minutes and days. So I can correlate very well, because Ghatipal we cannot use in these times, so we use this thing. And this as I marked here, so 22nd we have the Vikram Samvat 2080 started, and today 25th we are having this conference here. And to sum up everything, I repeat again, medical astrology is a complementary traditional Vedic healthcare system. Every physician's aid in diagnosing, management, preventing diseases. Hippocrates says a physician without the knowledge of astrology has no right to call himself a physician. And somebody asked Newton, if on a full moon night a mouse looks at the moon, does it have effect on the earth? He said yes. Every event, everything is interlinked. We had a medical conference a few days back and a senior oncologist with the 40 years experience was there, and somebody asked him question, does the environment affect healing in cancer? He says, in my 40 years of experience, I've seen where the house is positive, where the family is positive, where the energy is positive, I've seen cancers heal. And where everybody is negative. So we need to understand that whether it is planets, whether it is nakshatras, whether it is zodiac sign, whether it is all of us sitting here, we are all interlinked. And not only interlinked, we are influencing each other every moment. And that is the basis of Vedic medical astrology. Thank you so much. And I welcome Dr. Charak for his deliberations.